There we go, 3, 2, 1 live. So, do like to dabble with the filters on Instagram. I'm not sure what this filter is. Is it doing anything except making it go a bit brown? Don't really think so. So, I'm going to take it off. Oh, well, there wasn't a filter on. Anyway, okay, so something's happening now. So I got some hold on a minute, what's going on now? There's snow now. What is going on here? So right, okay. Okay, I'm going to click off. I think there's no filter on the Instagram, is there? Can't see, half the screen's taken up with the. Yeah, I've got a question here which says, what's the difference between saline and silicone implants? Good question. So basically, the difference is the contents of the implant. So when you have an implant, you've got contents and you've got a shell. And the two options for the contents are saline and silicone. Now, saline are kind of filled with saline, which is water, basically, salty water. We don't tend to use them in this country. I don't really know anyone, correct me if I'm wrong, anyone in this country who uses saline implants. I don't personally, I don't know anyone who uses saline implants, put it like that. Personally, I don't. So there may well be someone in this country who uses saline implants, but I personally don't know anyone who uses saline implants. And I don't think I've ever seen anyone use saline implants. So I don't think we use them much in this country. They do use them a bit in America still, because silicone implants were banned for a while, so they had to use saline implants. But in this country, we don't really use saline implants. All the implants that we use are silicone gel. Now, even saline implants have got a silicone shell, but the difference is that it's like anything in life. There's pros and cons, and there's certainly pros of saline implants. The pros of saline implants are if someone says, I don't want any silicone in me, and as I say, there was a time when silicone gel implants were banned in America because they thought it caused autoimmune diseases. They've subsequently been brought back. But even saline implants have got a silicone shell, so you still have silicone inside you if you have a saline implant. But I guess you could argue it's kind of less silicone. The saline implants, in one way, you could say they're kind of safer if they rupture, because it's just water. It's watery fluid, water. So it's all water. But one of the cons of them, along the same lines, is they can kind of deflate. They can lose. The water can sort of leach out through the shell, and they can deflate and lose volume. The other benefit is that you can put them in through a smaller incision. So if you've ever heard of the TUBA, TUBA, transumbilical breast augmentation, where they use an incision around the belly button to put them in, because they can sort of feed them up into the breast. I'm not sure if that's a gimmick. I think it is a thing. Again, never seen it done, but I guess if you kind of put an empty plastic bag up through the belly button and fed it up into the breast and then glue it up separately, you could use a very small incision. So that's a benefit of them. The main problem with them is that they are just that. They are bags of fluid, so they're much more prone to rippling, and the deflation thing can be a bit of a nuisance if they deflate and lose volume. And the modern day implants are what's called cohesive gel, which means that if they do rupture, if the shell does fail, the silicone doesn't leak kind of throughout the body. It sort of stays in place. So the modern ones are safer if they rupture. So that becomes less of an issue with the concern of rupture. So in my practice, there's not a huge benefit of saline ones, and I would be particularly worried about rippling if I used a saline implant. But and also I haven't had much any experience with them because as I said, they're not commonly used in the UK. So yeah. So there's lots to decide when you're having implants: what type of implant, what shape of implant, whether you put the implant in front of or behind the muscle, the volume. So there's all sorts to decide. and saline and silicone is one decision to have, but if there's any strength in numbers, the majority in this country are silicone, although there are differences in terms of the shell, but in terms of the contents, the majority are silicone gel. Do we offer laser cyst removal? No, we don't. We don't. Well, first of all, we don't do laser, so that would sort of answer that question straight off. So we don't do laser in the clinic. Laser cyst removal is, I'm not really aware of it being much of a thing. That there's different kind of types of lasers, and there are a lot of lasers which will target a sort of like a color. For instance, red, for instance, blood vessels. So things like red things, like red scars or red vascular malformations, or red patches and things, tattoos maybe. So lasers will target a certain color or a certain pigment. If you're going to use the thing about a cyst is not in the skin. A cyst is underneath the skin. So if you're going to use a laser, if you're going to consider using a laser to remove a cyst, you have to kind of get through the skin to where the cyst is. So the only way you could do that, in my mind, I mean, if someone does do laser cyst removal, then obviously you're better off talking to them because they probably know for real. But in my mind, the only way you could do that is to kind of like cut a hole in the skin. So then you'd be using like an ablative laser. So some lasers, you can use a laser kind of the same way you use a knife in that it cuts skin. So if you're using a laser that kind of cuts skin, then you could, I guess, cut it out, or you could make a hole in it or something and like get the contents out. The problem with a cyst is you have to remove the cyst wall. And so you have to kind of, I guess you could make an ellipse and get a cyst out with a laser just like you can with a knife. So I guess that's an option, but there's no difference in doing that to using a knife really. So you've got to ask yourself what would be the benefit in doing that compared to using a knife. So yeah, so we don't offer it, and I don't know anyone who does. If someone does offer it, let me know how they do it, because there might be something that I'm missing here. But I think, in order to get a cyst out, you have to get through the skin because it's underneath the skin. So I'm not aware of anything that can somehow sort of target the cyst. And so whether you use a laser to cut through the skin or a knife to cut through the skin, they're doing a similar kind of thing. And so yeah, so I don't think laser cyst removal in my realm is not really a thing that I've really heard of. How long does it take to recover from tattoo excision? So tattoo excision is like excising any sort of anything, any lesion or mole, or it's just excising a piece of skin. And so it really depends on how big a piece of skin you're excising. So if you have a really small tattoo, just like you have a really small mole, that's going to heal up quite quickly, and after a week you're going to be pretty good, although the scar will be red for a few months. But sometimes we do some quite big tattoos which are quite tight. So if you've got a big tattoo, I mean, by definition you're going to be excising a piece of skin, because that's how we do tattoo removal, by excising it. And so it will be quite potentially quite tight. And so if it is quite tight, particularly if it's in a tight area around a joint, around somewhere that's moving, then you have got to be a bit more careful. And we will advise you about this when you have it done. But if it is on an area that's under tension, we will advise you to avoid putting excessive tension. I mean, moving is good, but not putting excessive tension. Lifting, sports, things like that. We're probably 4 to 6 weeks to get the strength in it. So if it is, the recovery, you'll be sort of back to work as long as you've got an office job. But if you're sort of manually handling people, if you're, moving people around or lifting heavy items, then it'll probably be a month before you're lifting anything too heavy. And then we'd be gradually doing it as if you're going to be putting tension on the wound. We don't really want tension on the wound. But the scar will probably be red and active for a few months, and it might take 6 to 12 months for it to really properly settle and fade. Advice on removing a mole from the tip of nose. So here we go. This is quite a long one. I've got a flat mole on the tip of my nose. I went for laser surgery to get it removed, or laser again here. I believe that the laser used by the doctor was called ruby laser. The mole was gone for 3 days, then it came back. The doctor said that no laser would be able to get it removed, and that the only way to get it permanently removed was by cutting it off, but he refused to do the procedure because he said it would leave a scar. Now, a friend of mine told me that if I go to a plastic surgeon, it would leave minimal to no scarring. What do you think is the best move? Is there a better way of removing this mole, and will cutting it off really leave a bad scar? The mole is very small. So yeah, it goes back to laser, and sometimes people talk about laser removals of moles, and you can do a laser removal of a mole, but you know what, the way I put it to people is that if you're removing a mole by laser, you've got to remove the full thickness of the skin. You can't it's unless it's quite a superficial thing, but most moles you have to kind of remove all of the pigment, and that usually means destroying all of the skin somehow, whether that be with a scraping it, or with a blade cutting it out and stitching it up, or with a laser destroying it, or as I say, with an ablative laser to cut it out just like you would with a knife. So the more kind of skin you remove, the more scarring you're going to get. And with a mole, you'll probably, if you're going to remove all of the mole, I mean, that's the balance. If you use a laser or some way of, a lot of people on the YouTube and things often talk about these other ways of removing moles with vinegar and acid, God knows what, they're all sorts. So if you're going to remove things that only damage this, and they think it's no scarring. So if it's no scarring, then it's only going to superficially damage the skin. So the more superficially you damage the skin, the less scarring. But the more superficially you damage the skin, the less of the depth of pigment you're going to remove. And so what you'll find is when that's healed, you might still have the mole. So that's the problem. In order to convincingly remove a mole, you have to remove all of the pigment, and that usually removes pretty much the full thickness of the skin, unless you're talking about a shave excision, which are these raised lesions, which are often not pigmented. But certainly a brown mole, you often need to remove the whole area of the skin, and you can do that with a laser, but that's again going back to the ablative laser, the cutting laser, which cuts just like a knife. And so there's nothing wrong with that, but it will leave a scar just like a knife will leave, and you won't be able to send it for histology. That's the other thing. You won't be able to send it away for analysis. So if you've got multiple moles, it might be reasonable to use a laser for that. But if you've got one, and particularly if you want to send it off for histology, and it is good practice to send off brown moles for histology just to be confirmed that it was nothing to worry about, then you would need to remove it somehow, whether that be an ablative laser or a knife. And I would say that a knife is better because you can send it for histology. So you might say, he would say that because he uses knives. Well, okay, but I don't mind if, like tattoos, I always say, look, laser's first port of call. I'm not going to say excision is first port of call. Go for a laser, definitely first port of call. I've got no qualms in recommending laser for people with tattoos, but I have got qualms for recommending laser for people with moles. So yeah, plastic surgeons leave minimal to no scarring. Now, our work is focused on leaving minimal scarring, and we will work hard to do that. One of the issues is when you've got a mole, particularly somewhere like the nose, quite a prominent area, you have to leave a scar where the mole is. But we will do our best to place that scar in a favourable position. We will do our best to have it in a line that's perhaps will fade and maybe into a wrinkle or what have you, or into a shadow if we can. But if it's kind of like centre of the nose, it makes it a little bit more difficult. So, but for sure, we're going to leave as little scarring as possible. But it really needs a consultation as to whether it's worth it, because you say we leave a really bad scar. Now, usually scars on the face heal well, which we're fortunate. So usually they heal well. You can never guarantee it. And what it will come down to at the end of the day is how much it bothers you, as to whether it's worth the scar. There's always a balance, and there will be a scar, and we can do our best to try and give you an idea what that scar will be like, but no one can 100% tell you how it's going to be. So if it doesn't bother you that much, then don't have it done. But if it bothers you, then it might be worth having it done. But sometimes I warn people, especially if it's a small mole. Yes, then it's going to be a small scar. But sometimes say, look, the scar might be similar to the mole, you know. So is it worth it? You know, hopefully the scar will be really good and it'll fade and it'll be hard to see. That's always what we're aiming for. But we can never 100%. No one can guarantee that's going to happen. We're always aiming for it, but we can never guarantee it. So yeah, it's a discussion with the surgeon, and if it bothers you enough, then fine. But if it's a benign mole, then you do have to weigh up the pros and cons of having a scar versus leaving the mole. And it's a tough one, for sure. After breastfeeding, is it better to wait 6 or 12 months before considering breast surgery? Well, this goes down, I would say, to the word better. Better for who? So better for me is longer. The longer, the better. So 12 months is better than 6 months, if you ask me. The longer you leave it, the better, for a couple of reasons. Number one reason, your breasts have to recover after breastfeeding. And so the longer you give them to recover, the better, to see where we're going to be, to see where we are with volume, with shape. The skin might retract, the size might change. So if we want to see where we really want to be operating on a stable platform. So the longer it's stable, the better. So from a surgical point of view, 12 months is better than 6. However, sometimes I think 6 is kind of widely regarded as being kind of minimum, you know, because you need the breast needs to settle. I think 3 to 6 is kind of like the sort of standard, because the breast needs to settle and you need to settle, and also you've got a newborn baby presumably if you're breastfeeding, so you need to take that into account. But sometimes patients want to have surgeries before 12 months because maternity leave is 12 months. So I can completely understand that you don't want to take 12 months off maternity leave, go back to work, and then say, can I have another month off because I'm having, you know, some kind of breast surgery. So I completely understand why people want it within the 12 months, so maybe like 10 months or something. So it's not written in stone. I think it's kind of okay to do it at 6 months if things seem to be settling, but the longer you leave it, the better. So if you ask me, I would always go up to the 12-month end of things. You know, the longer the better. But I completely understand why some people say, look, you know what, I've got 12 months off, I'm going back to work in whenever, you know, I'm in my mind, I've got it all planned and I want to have it done in, you know, maybe 10 months post breastfeeding or whatever. So it's kind of something you need to sort of think about and weigh up in your own mind as to whether that's when the good time for you is. So and we will work with you, yeah, partnership, right? It's together, we're not against each other. We want to get the best result for you. And as I say, I can say you've got to wait 12 months, but you might say, well, look, you know what? It really suit me to have it done in, you know, September or February or whatever. And we're like, okay, well, that's 10 months. Yeah, all right, we'll do that then. I would be like, well, it might be better to wait another couple more months because things might settle. And you might say, well, I don't think they will. Well, okay, it's your body. If you don't think you will, that's fine. The only thing is if you do surgery now and they do settle, they do get some, you know, you use implants or something like that and they get smaller, then you might want it a bit. So, you know, you want to get the best, we both want the best result. You know, and so we're just trying to get the best result. So, yeah. So that's where I am on the breastfeeding question. So that's well, I'm out. I'll be honest, I'm out of questions on that one. So if you got a question, message me, phone me, Instagram. Oh, Loco Loopy has got a question. Hiya, after an uplift with implants, is it normal to have fat left around the bra line area? Should this have been removed or is this a separate surgery? So very good, Loco Loopy. I think a lot of stuff. Something I work hard at. I think we all, well, I hope we all do. Anyway, I work hard at is trying to be honest not on it, I'm not saying people are being dishonest, trying to be realistic with patients about what you can achieve with surgery. Before surgery, explanation is better than revelation. So you've got to tell people before surgery what they can expect so they can make an informed decision whether or not to have surgery. And I think the thing you're talking about might be, is it here? Often here, people have got a bit of fullness here, yeah, called accessory breast tissue. Maybe it's here, maybe it's on your bra strap. But anyway, the answer to your question is that, yeah, that's not part of a breast lift with implants. The breast lift with implants, we're dealing with your breast. Think about where your scars are. We don't get up here, we don't get down here. Yeah, the side bits, yeah. So you can't really get to those bits when you do a breast lift with implants. So kind of ideally, and I know it's not an ideal world because you've probably had, obviously the focus was on your breasts pre-op, but ideally, and I'm, we're all learning, and I'm trying to, make sure I say to people, I see things, say, look, I don't want, so you've got to get the balance because you don't want to give people a problem they didn't have, but at the same time, you want to point things out pre-op because you don't want to say, oh yeah, I think that doesn't get sorted in the breast lift with implants, because what you can do is you can do liposuction sometimes to these, certainly to these bits here and to these bits. You might, you can do liposuction to address those bits. And you can do that at the time of your breast lift with implants, but it is kind of like a separate surgery. But I can understand the frustration if you've had surgery and you're left with bits that you didn't like before, which you kind of thought were going to be addressed, and they're not addressed. And then it's like, if you told me, I could have made a decision whether or not to have liposuction, and I might have made the decision not to have liposuction, which is fine, but at least I would have accepted that they pointed out these bits will remain, and they've you've accepted what you can do with a breast lift with implants. Because when you're doing a breast lift or a reduction or whatever, you're dealing with the breast itself. You're not really doing much to the sides. You're doing to the lateral breast, yes, but not out here, not over by the bra straps, and not up here underneath the armpit. There's a bit of a bit. So that is an issue. So yeah, that's interesting you asked that question, Logo Luby-Loos, and I hope you're not, if it is you, I hope you're not too disappointed if that's happened and you've discovered afterwards that wasn't going to be addressed. But it's part of the job is to try and tell people before. Jackie's got a question. Jackie, top dog Jackie, where in brackets which hospitals do you perform larger surgeries? So Jackie, short answer, Asset Hospital in Liverpool. Long answer is you're like, what, Liverpool? I'm like, yeah. Yeah, basically, because I'm in Birmingham. I'm based in Birmingham. I used to work at the Priory, which is about 5 minutes away from my clinic in central Birmingham, and at the Parkway, which is about half an hour away in Solihull. So I used to regularly work there. But Parkway on a Monday and Priory on Tuesday. Do you know what it's like when, a bit like the COVID thing, when you kind of look back and realise that things you didn't appreciate. You've got to appreciate things, don't you? You didn't appreciate things that when you haven't got them, you think, crikey, God, that was great. I could just do an operating list. I'll go half an hour down the road, do an operating list, then halfway home, half an hour home, home for dinner, home for lunch. Hi kids, how was it day at school? Anyway, no point in lamenting how life used to be. Oh, you're in Cheshire. Oh, wait, you're up that way. So now, yeah, the surgery is in Liverpool, in Wiston, because I used to work in Wiston Hospital. I trained there, and one of the guys I trained with has got his own hospital, basically, just up the road from Wiston Hospital. And that is happening more and more with plastic surgeons. You're finding more and more plastic surgeons are getting their own hospitals because the private hospitals are focusing a lot on their NHS work. They're doing a lot of orthopedic work, and there's not really an appetite to sort of do much in terms of the cosmetic work. And so the Priory, which is 5 minutes away from my clinic, have said no cosmetic surgery, which is a shame because it's nice that it's 5 minutes down the road. Parkway do some, but it is difficult getting into the hospitals, and it's difficult because, as I say, I think they're focusing a lot on orthopedics and NHS waiting lists and what have you. So the most sort of, kind of steady is in the Asset Hospital in Liverpool. So near you, Jackie, near you, because yeah, just off the M67, is it? It's actually quite convenient to get to because you just got the M5, and then you. Anyway, yeah, it's Wiston. It's the outskirts of Liverpool. That's where it is. Nice place, nice bunch there. Really nice bunch. And so, yeah. And again, talking about gratitude and things, I'm just grateful I've got somewhere to operate. To be quite honest with you, Jackie. So, I am trying to practice gratitude, even the fact that I've got to drive an hour 45 up there and back. I'm just happy that I've got a reliable source of an operating theatre that I can use with a nice bunch of people, because certainly around the COVID time it was pretty difficult to get into theatres. Loco Loopy, what you got? I'm disappointed. Sadly, I am considering further arm reduction surgery. Could you remove the side boob skin at the same time as an arm reduction? Is this a specialty area of yours? I am. Great, thank you. Yeah, so first question, could you do it? Yes, you could. Loco Loopy lose. Arm reduction, you kind of can extend it on here to try and tighten this bit, which might address your problem. It kind of depends on how bad it is. I've got to be honest. So, is it a specialty area of mine? I've got to be honest with you, Loco Loopy lose. Arm reduction is not a common operation for me. I only do breast and body, so I don't do any faces. I don't do any non-surgical. But the majority of my work is kind of breast reshaping, whether it be lifts and whatever, implants and reductions and tummy tucks. Things like arm reductions, thigh lifts are not as common as the breast and tummy surgery, because the scar is a little bit obvious. The scar goes down the arm. So in my hands and in my practice, it's only for people who've lost a lot of weight, got a lot of skin there, who will accept that scar, because a lot of people say, I hate my arms, don't want to show them in public. And then I give you a big scar down your arm and you still hate it and you still don't want to show it in public. So it's like, I wouldn't say it's kind of like a specialty area of mine. I wouldn't say arm reduction is a specialty area of mine. I'm not sure if there is anyone who's kind of got a specialty area of arm reduction. Maybe there is, but it's something that I do for sure do. And again, so an arm reduction is only people with a lot of skin. So the thing that you're talking about with the bra strap is really, if you're extending your arm reduction, you kind of would want quite a lot of excess skin in that area. So it's really for people who lost a lot of weight. If it's only modest, then liposuction might be kind of a less invasive, because putting a big scar crossing the axilla can be a bit of an issue. So liposuction obviously is less scarring because you just make little stab incisions. So liposuction will be an alternative way of addressing certainly with the skin here. Not so good with the arm because the skin doesn't recoil, but certainly with the whatever you want to call it, the bra strap fullness could be addressed with liposuction, which might be less invasive than extending the arm reduction. But since you asked the question, yes, you can extend an arm reduction onto the lateral chest wall to tighten that skin. But I would say that's only reserved for people with an awful lot of skin, because it's increasing your risk of complications if you're bringing the scarring onto that area. But it's certainly something that can be done. And it's a balance, and it's having the conversation pre-op so you don't get disappointment post-op. So, obviously liposuction wouldn't remove skin, so there might be some redundant skin there. So you might say, I'm not happy with that. In this case, you can have the excision, but the excision is going to give you a big long scar with more risk of healing problems, etc. So we're always trying to avoid disappointment, to be honest with you, Loco Loopy lose, and it's always not stressful, but sad when someone's disappointed over something, particularly if the surgeon kind of thinks they've done a good result. If the surgeon feels, I've done a great lift with implants, and you're like, yeah, but what about this bit? And he's like, well, that was never going to get fixed. Well, that's a kind of failure of communication, which is sad to get an unhappy patient from a failure of communication. And I'm sorry that you're disappointed with the surgery. If you're disappointed just for that reason, because that was probably never going to be addressed, and you went in thinking it was, which is sad, isn't it? But yeah. So I would say, the problem with all this stuff, like answering stuff on these videos and things, I'll give you kind of ideas in general terms. You kind of need someone to examine you and to talk through the pros and cons. It's very hard to say to someone, yeah, you have an extended one that goes onto your arm. It's like, well, you've got to see someone, you've got to see the skin laxity and talk about the pros and cons, because it's all very well saying, yes, you can do an extended one, but it's like, well, is it kind of worth it for the risks? There's always going to be good things about doing it and bad things about doing it, and you've got to balance that up. And the good things are often judged by you and how much you're bothered by the excess skin. The bad things we can tell you, but the good things only you know. So you have to weigh those bad things against the good things to see whether it's worth doing. Are you going to just do a bit of liposuction, or are you going to extend that arm reduction onto your lateral chest wall? But yeah, you're very welcome, Loco Loopy Loos, for my in-depth response and thinking emoji. That's good. Is that? I didn't even know that was an emoji, but there you go. Learn something new every day. So thank you. Let me just check. Oh, is that the time? Look, Candice has just joined. What are you doing, love? It's 7:36. What time do you call this? Yeah, 7 o'clock this starts, right? Anyway, don't worry. You can watch the replay. It's been amazing. You've missed some quite amazing information. So if that is all, I will take leave of myself and exit stage left. Thank you very much for your interaction, Loco and Jackie. Gold star to both of you. Well done, yous. And so, yeah, I'm going to head off and put my feet up, and I suggest you do likewise. So same time, same place, 7 o'clock next Tuesday. I will see you back.